told you not to bring your baby to rehearsals.
I'm sorry, ma'am. There's nobody in my house. That's why I bring him. Come
here. You really need to get a nanny, please. I hope the baby doesn't disturb us this time around. House, we all know that Sister Julie and Brother Sam's wedding is coming up very soon. And there will be a lot of dignitaries in the house. So we need to put more efforts into this rehearsal. Okay? Alright. So we'll take it from the top. You are mighty and you're holy. You are lifted up above. No.
You know, we leave person. You know, the choir.
Sorry.
You're mighty, Lord,
And you're holy. You are lifted up above all.
so we worship
Almighty God, you are lifted up above all.
You are mighty, Lord,
And you holy, you are lifted up above all.
you are mighty, Lord,
And you holy, you are lifted up above all. So we worship you, Almighty God. You are lifted up above all. So we worship you.
Good evening, Daddy.
Welcome, Daddy.
Monsieur.
My mistress, I can see you people are doing a great job.
Thank you, sir.
Oh my God. You didn't tell me they have a new choir. How
Wow.
are you? God bless you.
Thank you, sir.
You are highly blessed.
Amen.
Praise the Lord.
Hallelujah.
My mistress, permit me to have one-on-one with Brother Sam and Sister Juliana.
Okay.
And may God bless you all.
Sister Juliana,
Bless
you
you
can
too,
take
sir.
your lead now. Okay, we take it from the top. Okay. We just start from. So we worship you. All right, let's go.
So we worship you,
Brother Sam, praise the Lord.
Hallelujah, Daddy.
Sister Juliana, how are you doing?
Fine, Daddy.
So how is the preparation for the wedding ceremony?
We bless God, sir. God has been faithful.
Yes.
In fact, everything for the wedding has been provided.
Hallelujah.
Amen.
Our God is faithful.
Yes, He is faithful.
So have you people gone for the medical test?
Medical test? Daddy, we are born again Christians. Why should we go for medical test? We are filled with the Holy Ghost.
Devil fighting, tongue speaking. Daddy, I'm medically sound. In fact, I'm still a virgin.
Yes, I know all of that, Sister Juliana. But according to the church tradition, before you get married, you must go thorough medical tests. Oh, Brother Sam, do you have any challenge with that?
Actually, Pastor, I don't have any problem with that. Just that I have faith in God.
Brother Sam,
Yes, Daddy.
it's not about faith. It is about doing the right thing.
Okay. Doctor, we are here for the results of the test conducted. Is he ready now?
Yes, it is, Mr. Sam.
Okay.
Ooh, at least I'll have fresh hair now.
Yes, of course. I think your pastor wasn't wrong at all. You see, diseases, when discovered at the early stage, can easily be controlled.
Okay. Yes.
But when you don't conduct periodic tests on your body, in fact, you put your health at risk. Well, from the just concluded test, Mr. Sam, we discovered that, madam, you have hepatitis B.
Hepatitis B?
Doctor, what is hepatitis B?
Hello and welcome to Raw Impact Africa, a program designed to empower the African youth through knowledge. Today we are talking about hepatitis. Good day, doctor.
Thank you. Good day.
Please, can you introduce yourself, please?
Okay. My name is Dr. Ifeanyi Ogun. I work with New Med Emerging Health Services.
Now, doctor, from the movie we just watched, what is hepatitis?
Okay. Yeah. Thank you for the topic you've chosen. First of all, hepatitis, as we've seen in the movie, it's a lot of people don't know about it. It's people hear about it, but they don't know what it actually is. Hepatitis is actually a virus. We'll call it a hepatotropic virus, meaning that it's one of the viruses that has a predilection for the liver. There are a number of types of hepatitis. You have hepatitis A, you have B, you have C, there is D, and then there's also E. Now, of major clinical importance is B and C currently because of the mode of transmission. For A is usually transmitted through things we eat and then sometimes food contaminated with fecal matter. So that is a lot easier to control. But for hepatitis B and C, it's usually transmitted through blood and then fluids from the system of infected people. So the risk and the rate at which people can get infected is a lot higher, and then it's constituting a major public health hazard these days. And one of the important features also is the fact that there is actually no cure yet for both B and C. And if it's discovered early, there are things that can be done. So that is why it's what you're doing now is is a very laudable project, because we need to educate people. People need to get enlightened. Like we saw in that movie where the pastor actually had to enlighten, had to counsel the couple who were about to get married to go and test. It's actually very, very important, because they say knowledge is power, and then God, in fact, it's in the Bible that my people perish for lack of knowledge. So if we don't have knowledge, then we cannot take positive action. So like what the couple did, and it's also important because a lot of times our religious and spiritual leaders do not want us to do those preventive measures. So in the movie we watched, it's what they did was actually very important for the pastor, who was seen to be a spiritual leader, to now counsel and then encourage the couple to go for that testing. And then we saw the result. But beyond the result, there's also a life after that, which I think we're also going to talk about that, so that people will be encouraged to go and test, and know their status.
All right. Thank you very much, doctor. You mentioned hepatitis A to E. Now, which is which is the deadliest? That's one. And which one do we have here predominantly in our country, Nigeria?
Yes, B and C.
B and C.
B and C.
Ah,
It used to be B, but now C is also rising up. So in most places where you go for screening, we screen for both B and C at the same time.
Okay. So the one that we have in Nigeria here is B and C.
Yes.
And those are the ones that are really, really deadly.
Yes, they are deadly. They are deadly.
So
They
now,
are almost
doctor,
incurable.
why, of all the places in the world, why will B and C come to Nigeria, sir?
It's not as if he has just come to Nigeria. It's something that has been with us all this while. But what technology and then advancement has also done for us is that things that have been killing people now will have a reason for those deaths. For instance, somebody can just complain and this is what happened, had maybe what we call abdominal pain, right upper quadrant pain, yellowness of the eyes, and then in the past we say, okay, maybe it's some who attribute it to a lot of things, spiritual attack, poisoning, and all of that. So it doesn't mean it had not been with us, but now that we have tools and technologies to detect it, in developed world, it has always been there. They've known about it, but for us, it has been with us, and but we're just beginning to find out. But another reason also is the fact that because of now the world is a global village. I'm sitting with you now, and the next 24 hours, it could be in New York, it could be in US. Because of that, migration, so to say, people go to places, mix up with people. So there's also a higher chance of people traveling abroad and then getting infection and then bringing it back into the country. So yes, it has been with us, but the incidence is also on the increase because of migration, and then the fact that the world is becoming a global village. Everybody has access to almost anybody and anywhere.
All right. Doctor, you see, in Nigeria, it's always been HIV/AIDS, malaria. We don't really hear so much about hepatitis, but from what you've made me understand, it's actually very, very dangerous. So how come we're really not hearing it?
Okay, that also is we won't lay all the blame at the feet of the government, but is lack of information. People were not aware of all this before now, but a lot of agencies are taking it upon themselves, just like you're doing now on Raw Impact Africa, to enlighten people about the prevalence of this disease. In fact, just over the weekend, we had to do an outreach, and that outreach, was to a local community, and one of the most, it was actually full health outreach, but one of the critical things we did was to screen for hepatitis B and C, and it will amaze you that we got up to 20% of the patients we screen were positive, and out of that, up to 20%, more than half of them were women. And then it's more important in women because we have a chance of preventing the spread from the mother to the child. Yes, HIV has been on the forefront all this while because a lot of donor agencies, there's been a lot of awareness about HIV. But hepatitis is almost, if not more deadly than HIV, because the drugs that are available now to treat and to cure to cure hepatitis are very, very limited. They are very, very limited. Unlike HIV, yes, there's still no cure, scientifically speaking, but there are drugs you can use to manage them, and then most of the drugs are provided free of charge. Now, for hepatitis, it's a different thing altogether. The drugs are not available. When they're available, they're expensive. If I tell you there's a particular drug we use for a pregnant woman who is hepatitis positive, and then we want to try to break the cycle of transmission so that that baby doesn't get hepatitis, there's a vaccine we'll have to give the mother just before the vaccine we'll have to give to the baby immediately the baby is born. That vaccine is very, very expensive. I can tell you that vaccine runs into almost 100,000, and then how many families can afford that? Now, the drugs for HIV would also have been that expensive, but because the government has come into it and then decided to subsidize and then deliver those drugs free, so it seems as if HIV is going down and then hepatitis is now coming up. So we need to be aware of this new challenge and then begin to tackle them effectively.
Yeah, Doctor, so many people know about HIV and other diseases that are prevalent in Nigeria. How come we don't have that idea about hepatitis? It will shock you, sir, to find out that I found out about hepatitis like a year or last year. I'm well schooled, I'm a graduate, I do my business, I've traveled abroad. I never knew of hepatitis until when my wife needed to deliver, and we were forced to go for hepatitis screening. So why haven't people really known about it? Because even my audience watching it down there, if you ask most of them now what is hepatitis, you'll be shocked. Like from the movie we watched, the two couple, they didn't know what it is. And when a doctor told them hepatitis, they were like, what is hepatitis? Do you understand? And that's why that gave us room for this program today. So, sir, why is there no much publicity, and why don't people really know about hepatitis so much?
Yeah, I think part of the reason is the fact that we talked about information, but also the fact that government has not actually come out with a policy on hepatitis as much as HIV. Now, a lot of people also have not been going into hepatitis, because there are a lot more funds. There are a lot more funds for HIV, in the recent past. So of course, people would, somebody sets up an NGO and then, you want to go into hepatitis, you are not likely going to get funding. But if it is for HIV, most likely you're going to get funding. People will support you and all of that. But I think that is changing now. People are becoming more aware. A lot of agencies, NGOs are beginning to enlighten people about it. Now, it will interest you to know that up until now, if there is most people that go for premarital screening, a couple wants to get married, they want to go for screening. Hepatitis is not part of the routine investigations. Usually you do genotype, you do blood group, we all know about that, and then you do HIV screening. Before now, hepatitis was excluded. So it's just recently now that we're introducing it, that every couple that wants to get married, they have to be screened. Then another important point is at the antenatal clinics. It has become a federal government policy now, even in private hospitals. Once a woman registers for antenatal, hepatitis B and C are those are mandatory investigations they have to do before the woman puts to bed, because that's also a point where you can detect a woman who is positive, because one of the routes of transmission is from mother to child, what we call vertical transmission. So in the process of delivery, that baby can actually, an innocent baby can actually get the virus. But thank God there's also a vaccine for that. Unfortunately, that vaccine is slightly expensive, but at least people are aware, and the people who can afford it can provide it to their loved ones.
All right. Well, thank you very much, Doctor. If you're just joining us, this is Raw Impact Africa, a program designed to empower the African youth through knowledge. We shoot short films on fundamental life issues and get seasoned guests to come and analyze those issues as they affect our life. Today, we have been dealing with the topic hepatitis, and Dr. Ifeanyi here from Neomed Hospital here in Abuja has been doing justice to it. We're going to take a short break now. Don't go away for Raw Impact. We'll be right back. All right, welcome back. This is Raw Impact Africa, and today we are talking about hepatitis. And Dr. Ifeanyi here from Neomed Hospital, Abuja, has been doing justice to it. Doctor, now, what is the mode of transmission of hepatitis? People want to know.
Okay, like I said, hepatitis is a virus, is a hepatotropic virus, usually transmitted through blood and fluid. Now, blood is, like we all know, blood, fluid, any kind of a liquid that comes from the body of an infected person. That could include sperm as well, which all now goes to say that it can be transmitted through injections, if unsafe injections. For instance, if a healthcare provider gives injection to somebody who is positive, and then uses that same injection to now, because there must be a crossing of the blood from the infected person into the uninfected person. That's how it's transmitted. And also sex, because of from semen and then from vaginal secretions. So that's the mode of transmission of hepatitis B and C.
Yes, yeah.
Like I said, there are other hepatitis viruses. They have A. A is fecal-oral, which is through what we eat, and then which is contaminated with fecal matter. Then D, E, and all that. But most important now is B and C, which are through blood and then fluids.
Body fluids, you know.
Yeah, body fluids,
And when
exactly.
doctor is talking about body fluids, saliva is inclusive. Is sweat part of it?
No, sweat is not.
Sweat is not part of it. Okay.
Sweat is
Okay. So saliva, sex, which is one of the most common. So please, I urge you out there, if you must have sex, do that with a condom. Don't tell us that skin to skin or the sweet. When you have hepatitis, from what doctor said, there is no cure for hepatitis now. So why don't you save yourself the problem of just trying to play safe and use a condom? We'll say it again and again. Now, doctor, from the movie we watched, we saw this spouse, they want to get married. The pastor tells them, is the church doctrine, you need to go for test. They went for the test, and the result came out, and the lady has hepatitis and the man does not have hepatitis. Now I want to talk about management of hepatitis. First of all, sir, should that marriage continue? That's one. Then two, if you are already married and you now realize that your spouse has hepatitis, what's the way forward, sir?
Okay, that's a lot of questions lumped up in one. So
Yeah.
I'll try as much as possible to disentangle the questions and then give answers to each of them. Okay, maybe we should deal with the management first, and then we'll come back to whether the couple should go ahead with the marriage. What we call a non-concordance. One of the couple is positive, the other is negative, because that is there is no one straight answer to that question, but we'll come to discuss that further. Now, for management of hepatitis, once the normal tests we do are called screening tests, like what we do in the outreach, what they do when you come to a hospital. The screening is a screening test. They'll do hepatitis B and then C. What actually that test does is to look for an antibody in the system of the patient. Now, antibody is is a substance secreted by the body to fight against that virus. So it's an indirect way of establishing that that you have or you have had the virus. Now, I'll give you an example to drive it home, especially to our listeners. If, for instance, let's say the country is at let's say the terrorists, the Boko Haram. Now, let's assume that the army has a special unit that fights Boko Haram. That's what they're designated to do. Now, you go to maybe, for instance, the northeast, and now you want to check whether Boko Haram has had an attack in this place in the last maybe couple of days or months or weeks. Now, the only evidence, you're not going to see the Boko Haram soldier there, but the only evidence is if there is a Nigerian soldier specifically designated to fight the Boko Haram. If you find him there, you can infer that Boko Haram was here. I don't know whether you get what I'm trying to say. So it's an indirect evidence that this person has hepatitis because that immunoglobulin, which is an antibody, has been secreted and is available in the patient's blood. So it means that most likely this virus is here because that virus is that immunoglobulin is only secreted in response to that that's what we call antigen. That's the virus, so to say. So so that's the first line. So when you do that screening, it does not mean conclusively that person has hepatitis, just like with HIV. That's also the same thing. So we'll have to go a step further to confirm whether that patient actually has hepatitis, because the technology and the means of detecting the virus itself is slightly expensive. So it's not something you can go into the field and say, okay, let's look for this virus in all the patients that come, 1,000, 2,000, up to millions. That will cost a lot of money. So we'll do that indirect first. Then we'll get a positive result. Then we can now go ahead to confirm. So for the couple we are discussing, that we saw in the movie, and then looking at the management generally, after the screening, the next thing you do is now to confirm, and then that's what we call the hepatitis B virus profile. That's what's called profile. Is a number of lab investigations that we'll have to do to confirm the presence of that virus. Now, so there are certain clinical scenarios. Somebody can have a positive hepatitis C screening. Now, there are a number of things that can happen. It can have an active infection. It can have an inactive infection. It can be a false negative. Sorry, false positive.
Okay.
Yes, an active infection means that person has the virus and is replicating, is multiplying in the body, and that person is infective. And then the symptoms are usually also there. An inactive infection means that person has had that infection in the past, maybe a long time ago, and then the body also has a way, that's the immune system, has a way of taking care of that infection on its own. So it's also possible that body, the patient's body has taken care of the infection, but the antibody, which will test in screening, like I said, is still there. But that person is no longer infective, so he can't transmit the infection to another person. The infection has already been cleared. Is no longer in the person's system at all, but is still reactive. That also happens, in some cases. So that is why we need to do the confirmation. Then the third group is a false positive. There are also a number of cases where you get a positive result, but that doesn't really mean that immunoglobulin is there. So we need to go a step further. So when you do the hepatitis B profile and it's now confirmed that person has an active infection, then we'll now go ahead for the treatment. Now, the treatment, there's actually no cure for hepatitis, but there are a number of drugs called antiviral drugs that we can use to kind of step down the rates of multiplication and then the effects, the clinical manifestations of the virus, and the person can live a totally normal life. So that is on one angle. Then I think I mentioned it earlier, for children, for neonates born, that's children born to mothers who are positive, there's a drug we give. Now that drug is also an immunoglobulin. So what it does is once you give that injection, it goes into the baby's blood and then clears that virus that the child just got in the process of delivery. So that immunoglobulin is also a treatment, and that one is curative, because once you're giving it to that child, it clears that infection and that child is fully okay. So that is a part of the management. The other things is if it's an active infection, beyond the antiviral you give, there are also other number of measures and drugs because the drug affects the liver, it leads to liver failure. So there are also other things you do. For instance, avoid high protein diets and avoid meats, red meats, and all of that. A lot of advices that advice will have to give, and then drugs that also will help the liver to regenerate its function. So there are a whole lot of money, but that has to be done in a hospital setting.
All right.
Then talking about whether the couple should go ahead or not. Yes, it's from the point of information. Information is key. Information is power. So that is why you need to screen. Now, when you screen, let's just go straight to the point that, okay, you've done the screening is positive, and then you've done the profile and it's confirmed that the woman is positive. Yes, the marriage can go ahead. Really? The marriage can go ahead, yes. Even in discordant couples of HIV, the marriage can still go ahead, but at least you know what it is, which means that we avoid fluid as much as possible, like we saw in one other movie, I think by Raw Impact, also on stigma. Okay. If the man had to sleep with the wife, he has to use a condom, he has to use a protection. So that is also what has to happen, and you avoid fluids as much as possible. It doesn't mean that marriage has to be cancelled completely, but if the two of them sit down and then they decide they are not going ahead with the marriage, then it's from a point of knowledge, it's not from a point of ignorance. So if the man decides to stick with you even though you're positive, or the woman decides to stick with you even though you're positive, it means that there's honesty in that relationship, and then it can go ahead. Not that maybe one day, sometime down the line, somebody just finds out and then it brings mistrust and then quarrel and then all that into the marriage. So I think my general counsel is you give them all the options. That's also what we do as medical professionals. You give them all the options, give them advantage, disadvantage, then the couple makes a choice on what they want.
Now, talking about that now, finally, sir. Now, the man doesn't have, the woman has. And somehow they've been sleeping with each other anywhere, but he didn't have it. Now, what are the chances that he will never have it again? I know that there's a point where you need to go and take, you're going to take, they will ask you, the man, to go for immunization. Yeah. So now, what are the chances, if you take the immunization now, is it that you can never have it again, or somehow it can still get to you?
Well, the immunization does not confer 100% immunity. Okay, that's also another point of the management that we missed. But for people who are negative, they will have to take the immunization. The immunization is a protection against further infection. Okay. Yeah, but the immunization is not 100% protective, so you also will need to do other protective measures. So if the woman is, for instance, in this case, positive and the man is negative, and then the man gets hepatitis B vaccine, yes, that confers some level of immunity, but also the other methods of preventing the transmission will also have to be put in place.
So what are those measures? Because we are not looking at it now from, well, it's there, we know it's there. Yeah. Now we're trying to look at what's the way forward. So now, how can the other man now who doesn't have it, how does he protect himself? Fine, he has gone for immunization, fine, okay. Yeah. So what are other things that he should do?
Safer sex.
Oh, safe sex.
Yes.
So even if you're married now and your wife has it and you don't have it, you're going to be using condom throughout the rest of your life.
Yeah,
man,
that's what it's
how many men in Nigeria will actually subscribe to it? Man, well,
it's doable. It's doable because, again, using a condom is also part of family planning. Yeah, that's also what we teach couples in family planning clinic. So every family planning method has advantages and then disadvantages. So there are couples who can actually opt to use condom. There is no medical problem, so there's no medical situation, so to say. But for preventing further pregnancies or unplanned pregnancies, they opt to use a condom. So I don't think using a condom is as bad as we think it is.
This challenge of it's there, one person has it, one person doesn't have it, and they are trying to avoid kids, and they don't have money to take the vaccine when the baby is born. So what do they do? Is it that they should stop giving children or go for a permanent protective measure or child control?
No, they can still the couple can still have children. They can still have children even though the woman is negative.
Okay.
But you see, everything is almost possible as long as you plan for it. You know, for instance, if a woman knows she's already positive, takes in, the couple has to begin to plan, at least to save money, to work towards it, to get that vaccine. And then even before they get that vaccine, if the woman is confirmed to, you know, we've done the profile, and then the woman has an active infection. There's also other things we do, like the viral load, you know, the number of the quantity of the virus in the woman's blood system. There's also a way we can estimate that. So if the woman is also on drug pre-conception before she takes in, we can step down the viral load to a level that she cannot transmit it to her baby. So her baby actually may not require that vaccine when the baby is delivered. But like I said, knowledge is very, very important. Information is critical. So when you know what you're up against, then you can plan and work towards it.
Wow, please, my people, did you hear that? When you know what you're up against is better for you. I have this problem with the African man. They'll always tell you something where you know no go kill you. But that is not true. Something where you know no, na him go kill you. Try and get all the knowledge you need, because that is what can help you. Let us stop living in ignorance. Let us stop living in Oyibo. Nobody Oyibo bring this one come. It's there. So please, let us try to avoid some of these things so that we can live a better and healthier life. Dr. Ifeanyi, please, what's your final word for Nigerians?
Well, my final word for Nigerians is, from a healthcare perspective, let's try to prevent. A lot of diseases are preventable. The commonest diseases, you know, recently we heard about, elites in this country dying, especially in the football arena. We had like 2 coaches that just died. It's important for us to go for preventive health checks. You know, for a man, you can screen for prostate, you can screen for a lot of diseases, you know, ischemic heart disorders, things that can lead to cardiac arrest. You can screen for your blood pressure, you can screen for your blood sugar. A lot of these things, we take them for granted. For women, you can screen for breast cancer, you can screen for cervical cancer. If we're able to eliminate most of these things, we won't have a lot of major health challenges in this country. So I advise us to go for preventive health screen. It's cheaper and then it's safer.
Wow, thank you very much, Doctor. And that reminds me, our next edition with Dr. Ifeanyi is actually going to be the importance of periodic tests. Nigerians, we don't like going for tests. You want to get sick until you're near death, then they will not take you to the hospital. Why can't you just walk to the hospital on your own for, please, I want to check my liver, I want to check my brain, I want to check my breast for cancer, prostate, and everything. So another edition of Raw Impact Africa, we're going to bring Dr. Ifeanyi again to talk to us on the need and importance for periodic tests for everybody. Doctor, it's been awesome having you around. Well, that's how far we can go on today's episode of Raw Impact Africa. Now, next time we are going to choose another topic where you're going to watch another short film, and I'm going to have another guest who is going to tell us so much on what we need to learn. The truth about the matter is, knowledge is all you need to go to the next level. Once again, I remain Emmanuel Eyaba. See you next week.